Hello, Jane community. I'm Kendall Hagensen. This is Jen Drummond, and we are here on Jane's office hours. So, if we haven't met yet, I'm Kendall. I am a somatic psychotherapist and a multidisciplinary clinic owner and a business coach. Most importantly, Jane Ambassador, and I'm happy to be here. Jen, welcome. Do you want to introduce yourself?
Yes, thank you so much for having me. My name is Jen Drummond, and I am the CEO and founder of Hummingbird Clinical Consulting. I'm also a former clinician and clinical director of a multidisciplinary practice. Our consulting agency provides strategies for improving business performance, reducing clinician burnout, and improving client and staff retention. And I am also a proud Jane Ambassador.
Awesome. Well, I'm really excited for our chat today. We're going to talk about managing practice stress and burnout, which I think is something we can all relate to. And you
Yeah.
and I have quite a bit of experience with. So let's jump in. I think both of us hear from practitioners and clinic owners often that they're overwhelmed, just in general, but with workloads, less time than they thought they would have as a practice owner or a practitioner, time with family and friends. And we all go into it feeling like, I'll own my own business and then I'll have more time. Right. And that's often not the case. Um, Sometimes the burnout is really due to inefficient systems and practices within the business that can actually be solved. So I'm curious, like the habits that you've seen with practice owners or clinicians that you feel are adding like causing stress to the daily
Yeah.
routine or that general sense of burnout, overwhelm.
Yeah, I think that's a great question. Um, Inefficient work habits can definitely increase, workplace stress. And some of the habits that I've seen just in the clients that we worked with, or even just within our own practice, is poor time management. So overscheduling yourself with either a lot of tasks or an unrealistic time frame in your day can add to stress. And then on the other end, I would say things like procrastination or lack of prioritization. So, prioritizing low value tasks instead of focusing on critical responsibilities in the day. And then the other one that comes to mind, which may be surprising, is multitasking. So we often view
Hmm.
multitasking as a positive thing, um, but it can actually hinder our progress and increase stress. So if you're attempting to juggle, multiple tasks at once without clearly focusing on the goal for the day, it can lead to increased errors, inefficiencies in the day to day, or just extending completion times of those tasks. So essentially, causing a bigger workload for you in your day.
Yeah.
Um, and I think the other one that comes to mind is just lack of delegation. So trying to do everything yourself or taking on more work that may not be specific to the role that you have is also a habit that can increase workplace stress.
Yeah, I agree. It's really twofold, right? There's things we can do as practitioners and there's things we can do as practice owners. And then also as practice owners supporting practitioners on our team to
Right.
learn more efficient practices. Can't tell you how many people, would come onto our team and or have come onto our team over the years, and we're setting up their schedule and they're like, "Oh yeah, I'm just going to work from 8 to 4, no breaks."
Yeah.
I mean, the
Great.
amount of practitioners I've met in this realm, and it's like it's mental health counselors, it's acupuncturists, it's massage therapists, and
Yeah.
acupuncture is one thing because there's certain providers where you do step out of the room sometimes and you can eat a snack or whatever, but I still would kind of push for, and I do as an employer, we're going to build in breaks and you're going to eat some food. We're going to nourish ourselves, right? And we're going to hold each other accountable in that way. I think taking breaks and eating and moving bodies and things like that is probably one of the biggest practices that in our minds as healthcare providers, we think, oh, yeah, we're doing that and we should be doing that. But oftentimes we're not.
Right. Yeah, I agree. And I mean, the habits are different if you're like, to your point, if you're talking about a provider or a clinical director or an owner and how you're managing the day-to-day for your team. Um, so absolutely having effective communication as well is paramount with team members and also from, the practice owner to the greater team.
Yeah, absolutely. I think a few items, for those of you who are kind of just starting out or you feel really stuck in just overwhelmed, not knowing what you should prioritize and how to use your time wisely. I think for providers, a few things that we've seen be successful over the years: always arriving early for your first session of the day, be prepared for your clients, right? Rolling in 2 minutes before your first person. And I've had a lot of providers tell me, "Oh, I prepared the night before," or I can just jump in, right? That energy starts your entire day that way, of feeling rushed or behind.
Right.
Completing your chart notes in absolutely same day. This is our practice, and some people might disagree with me on this because a lot of clinics have a longer leeway. We actually say in between every session, to complete your chart note. And I feel personally that that is the best practice. A lot of clinicians like to do it end of day. And then a lot of clinicians are not doing notes daily. And that can create a ton of stress to feel the weight. If you picture note after note after note after note in a pile, and that is sitting waiting for you, that's very heavy.
Yeah.
um, Scheduling breaks, lunch, meals, adopt a personal practice in between each client session to let go of the energy of that session. If you're feeling super depleted at the end of the day, this is something to really pay attention to. And I'm curious your thoughts on it too, of how do you actually release the energy from that person? And I'm a mental health counselor, so we have an experience that might be different from other providers. But I would still argue, if you're an acupuncturist, if you're a massage therapist, the energy that energy flow that you have with your client, how do you not keep that in your body in between those sessions? And we can kind of talk about some strategies, really working towards a schedule that works for your life and your energy. For example, I always felt, I don't see clients anymore, but when I did, I always felt better seeing a 7 a.m. or 8 a.m. client than I would never see a 6 p.m., 7 p.m. client. My energy is not where I want it to be, right?
Right.
Um, and then for practice owners, a few things briefly before we move to our next topic. Um, I think we'll probably get into a lot of questions at the end for practice owners, and I've talked on a previous office hours about current schedule versus ideal schedule and administrative practices.
Mhm.
And I think just in general, we can get in more details in a bit, but honing your administrative and executive functioning skills and that time management of, like you were talking about earlier, when are you focusing on that one thing and not 20 things,
Right.
right? Okay, so when we're in this state of overwhelm, right, it's hard for our brains to step back and really look at, well, what's not working and how do we get out of it, because we feel like we're stuck in the
Yeah.
cycle. um, so how can people even address efficiencies? How can they even step back and assess and then identify like what's working and what to change?
Yeah, that's a great point. When you're in it, it's difficult to see a way out, especially if you're in that heightened state, anxious, stressed. Um, I think one good suggestion is through self assessment. So, using a tool like a journal can be useful. And you can use this to track interruptions in your day, your energy levels throughout the day, and even your emotions. I often feel like patterns can reveal inefficiencies from the day to day and provide you with some, quality data to be able to make decisions about. Um, the next suggestion I would have is just assessing your workload. So, to your point, what energizes you in the day and what
Mhm.
causes you to feel very drained? And then assessing what tasks either feel pointless or redundant or overly time consuming, and writing all those things down so that, you have notes of them. I think another good suggestion is just to define success and what your goals are in your work. So writing down, your top 3 priorities and comparing them to what you spend the most of your time on. Oftentimes, if we're consulting with providers, we can see, misalignment could also signal an inefficiency. Um, Another suggestion that comes to mind would be just to look out for burnout triggers. So we talked a little bit about, inefficient multitasking and how that can lead to fragmented focus, lack of delegation if you are within a team setting, and then just poor boundary setting. Are you working over your defined hours? What does that day-to-day look like for you in your schedule?
I had one of my most impactful mentors in my life years ago. Look, I was in supervision with her, and she looked at me and she said, Kendall, when are you not working? When are you not working?
Yeah.
Can you tell me the exact times when you plan to not work? And that was a turning point for me. It was very, very early in my career. And it sticks with me, right? Because the work will always be there. There's
Yeah.
always going to be more. There's always going to be things that we need to do as business owners. There's always going to be more we could do as providers. And so it's really important to pause for a minute and think about how we want to be spending our time and energy. I think
Mhm.
as employers and leaders, it's really easy to see when other people have inefficiency in their work and to be able to coach them on it. And sometimes it's more difficult to look internally and go, oh, well, where are our inefficiencies and how can we be doing this better and conserving our energy? The current versus ideal schedule exercise is exactly what you're talking about. It's assessing, really making a list and assessing what is depleting you and what is energizing you in your
Right.
work. So it's writing down all 7 days of the week, hour by hour. How do you typically spend that hour? Weekend days, weekdays, right? From the time you get up, time you go to bed. Making a list. What are the things that are depleting you? Then making a new schedule, all 7 days of the week, hour by hour. This is your ideal schedule. And really setting aside those barriers that will come up in your mind of like, oh, well, I couldn't possibly not do that because who else would do it? Right. We're just going to gently set that aside and come back to it because it's important. Someone's going to do it. Right. But it doesn't necessarily have to be you. So, what's the current or the ideal version of your schedule, and writing out what would you prefer to be doing with your time, and put in your non-negotiables first. Like,
Yeah.
you're going to pick up your kids at 3 p.m. every day from school. Yes, keep that on your schedule, right? You're going to put in your breaks for lunch and your other breaks and your self-care time. And I encourage you to put that in first, then your client schedule. And if you're not seeing clients, of course, your other meetings or whatever you're doing, but it's an ideal. And then you're looking at the gap between those two, make a timeline. What are the steps? Work backwards. Um, and as everyone knows who joins these office hours, you can email me if you need more instruction around that exercise. But it's very, very powerful. And I encourage you to do it every 3 to 4 months to really, even just taking the time to
Yeah.
make the list and create the schedule is very impactful and can just give you information, right,
Yeah.
about how far in the weeds you might actually be, right?
Mhm.
Okay, so let's say people have identified the areas that are causing them stress, whether in practice ownership or as a provider. Um, and how can they actually sit down and create a more efficient workflow and reduce stress?
Yeah. That's a great question. So I think, from my perspective, burnout really is a gradual process and it takes some time to recover from that. I think making small adjustments and focusing on self-care while you are trying to tackle those inefficiencies is really important. Um, I have a resource that I use for my clients, and it's essentially like a 10-step resource to optimize workflows, but I'll kind of condense condense it as I'm trying to explain. But I think the first step is always just to set clear goals and define what success looks like for you. So, goals may include things like reducing time spent on certain tasks, minimizing errors, whether they be administrative or clinical errors. Another goal may be something like improving collaboration. So, really having that clearly defined would be a first step. And then the next is really working towards analyzing that workflow. So evaluate the current workflow by utilizing data that you may have available to you, and then detect either pain points or bottlenecks within that workflow process, what's working and what's not. And then this next step is something that I really love to encourage, but it's essentially developing a workflow map. It allows you to visualize all the tasks within that workflow just to grasp the bigger picture and to really identify, those pain points and those bottlenecks. And then the last steps would really just be to standardize operating procedures for common tasks, and then automate things that make sense within that work process, and then delegate tasks to other team members, if it makes sense within that clinical practice. And then my last point would just be to engage your team members that are involved within that workflow. Their feedback can also be really valuable as you're working within a collaborative team. So looking for feedback across all departments that are involved within a specific workflow.
Yeah, those are great. I think once you've decided that you're going to change a system because okay, this is going to make things much better, it's going to make it more efficient, it's going to reduce our time and energy, then communication to your team, or if you're a provider, communication to your patients. Like,
Yeah.
let's say, for example, you're switching EHRs or you're switching softwares. This is kind of a big example that I see. If you're leading a team and you find this amazing new EHR and decide, okay, this is going to make it so much better for everyone, it's a big change. And it takes a lot of work to switch over, right? Or to switch to a new phone system or something like that.
Yeah.
So you have to get buy-in from your team and communicate so clearly. Here's why we're going to do it. Here's what the problem was. And everyone agrees, oh, yes, that was the problem. Here's why we're going to do it. Here's how it's going to solve our problem. Here's how it's going to impact you positively. And here's the timeline.
Yeah.
And here's what I need you to do differently, if anything. Right. Because there's, especially with a software change, they always push back from a team because we just don't like change and we get used to doing it the way we're doing it.
Yeah.
So those things are super, super important. Okay. So speaking of softwares, what are some softwares and tools that you have utilized or seen other practices utilize that have really benefit, clinic owners and practitioners day to day in creating more efficiency? There's so many options now with like practice management. Yeah.
There are. I'll maybe touch on maybe two features within Jane that I love to recommend. But I think the task feature is just an
Yeah.
amazing tool, yeah, for communication. Within the practice, like the team members, but also just to keep track on patient files. And it's a simple feature, but it's really efficient and it's really effective. That would be my first. And then the other feature that I love within Jane is also the pin to chart feature. So I
Mm-hmm.
tend to use this in practices where recommendations of care are varied per provider and they may change often. So when I work with a lot of chiropractors that have different recommendations per series of adjustments, this can be pinned to the top of the chart after a recommendation of care is made. And then when that client walks up to the front desk to book their next series, that information is already on the patient chart. So that workflow becomes very efficient. Nobody's getting, missed or slipped through the cracks. And, that recommendation of care stays up there until their next series or their progress exam or whatever it may be. So those are what kind of come to mind with Jane, but there are also other tools that you can use outside of Jane if you are looking to improve communication. So whether you're wanting to have a team meeting and not everybody can be in the clinic, you can use, Microsoft Teams or Zoom to make communication more accessible. If you need to share documents, you can use a Google Drive or something like that. So those are the main ones that kind of come to mind right now.
Yeah, for sure. I agree with the Jane features. We definitely use the pin to chart and then also the sticky notes.
Yeah.
As a multidisciplinary team, those notes are really helpful in the task feature. Also, just being able to put comments on the appointment in the
Mhm.
schedule, I
Yeah.
think is it's honestly one of the most used forms of communication that we have on our team to be able to make sure that because we have two locations, if
Yeah.
that patient is going between the locations or there's a different admin that day, that just everyone's in the loop. What's going on, right? We
Yeah.
offered this person a free sauna, or hey, remember this person never wants to use CBD ever. Don't offer it to them, or things like that. That just help
Yeah.
with hospitality and communication. Definitely Google Drive can be used for so many things and making things more efficient. Also, Slack is a very popular communication tool. Um, I think it's really great for community building within your team. And just, we have channels like the Feel Good channel, and we'll just post like cute pictures of our new baby nephews or whatever, or our new puppy, like, and just
Yeah.
kind of make each other happy. And then trust driven care is one that a lot of the Jane community has been talking about too, and creates a lot of efficiency in communication, all forms of communication. And really, for admins, uh, the combo of Jane and something like trust driven care, a CRM or communication platform, it really saves
Hmm.
a lot of time for
Yeah.
the admins. And then project management tools like Trello, Asana, those types. There are a ton of project management options now, and it just kind of depends on your style. Even Google Sheets has, within Google Drive, has a template that is like a project management template,
Hmm.
and you can have a task start date. What's the priority? Who are you assigning it to? Here are the comments. Is it in progress? Is it not started? Like, um, it's simple
Yeah.
and really helpful if you are managing, if you're in this multitasking flow and you don't know really what to do first. Something like that is helpful. Or, a good old fashioned written note, hand note, and sticky note. I like to.
Yeah. They're bright. You notice them.
They are. They are. There's also some reusable sticky note options coming out now, which I think are pretty cool if you're like a pen to paper type person, but you don't want to waste paper.
That's cool. I didn't know
Um,
about that. Like silicone?
yeah, they're I've seen they're they make them in different sizes, and it's like something that kind of sit under your computer, and you just write with like a whiteboard marker on it, and you can
Cool.
erase it anytime. So,
Yeah.
or you could
Neat.
just get a small whiteboard.
Yeah. I'll look into it.
Yeah. Um, okay. So, last kind of question before we answer everyone else's questions who are with us today. So, stress and burnout can often come when, as leaders, if we feel like we're doing more work than we should, or if if as providers, if you feel like you're doing more work than your colleagues, or more work than the scope of your job.
Yeah.
Um, so, how can we constructively discuss roles and responsibilities, make sure that's clear, and really prevent people from being overworked? I think a lot of us open clinics with an intention to, first of all, not be overworked ourselves, but also to create a work environment where our providers are not overworked. And then sometimes it can get into this flow where that kind of accidentally happens because things are not, our systems are not efficient.
Yeah. I think, we talked about this already a little bit, but how delegation can reduce stress. But I also feel like it can really leverage strengths and improve a culture within a practice. So, being able to assign tasks to those that are best suited for, either those tasks or that role, I find, anyways, can improve the quality of the work and then just the efficiency in the workflow. And I find when teammates are assigned job tasks that are aligned with their goals, for their own practice and also their values, we often see a higher engagement in clinical practice, and staff retention. So we use tools like personality assessments and
Mhm.
team assessments that can help just evaluate the overall team structure, strengths of those team members, and then also identify areas of improvement, and maybe workshops or seminars that can be facilitated for the entire practice. So that's the first, just the first thing that comes to mind. I feel like you had a second part to your question.
Well, I think you're kind of covered it. I just think it's really important if people are feeling overworked. I think it often comes from confusion of their role also.
Right.
So I think number one, making sure you as the owner or you as the solo provider understand what is your role, what are your tasks and responsibilities, and what are everyone else's roles and responsibilities, and are they aware that that is
Yeah.
in their job description? Do they know who does what in the company, and do they know who to go to for which types of questions? Because a lot of the inefficiencies can come from, you're getting asked what feels like a bazillion questions a day from team members, and you're sitting there going, well, this, they should know this, or they should go to this other person for this question. But
Yeah.
the very first thing we have to do is look inward and think, well, have we been clear enough about
Right.
this process? I also think a really important practice that we've implemented over the years that helps team members not become burned out are frequent check ins,
Mhm.
formal and informal. Of course, performance reviews, but also check ins. So, as owner of the clinic, I have a practice of meeting with every person on our team at least one time quarterly for this more kind of formal check-in, and then lots of informal. And then also their immediate supervisors or their team leads, as we call them in our company, are doing that, on a regular basis. And we're asking things like, what's going well for you in your role? What's not going well for you?
Yeah.
Right? What actually energizes you in your work? What's depleting you? Who's been, impactful in your in being supportive to you or in your training? What are your pain points in your job? These are the opportunities where we find out that an entire part of onboarding got missed or something,
Right.
right? Where they literally don't have the information. So no wonder they're struggling in this area, right? And this one conversation solves that problem and everyone's feeling better.
Mhm. Yeah,
Yeah.
and, like, an immediate shift that you can see in a practice is just implementing a morning huddle, and I know that's not, like, on the individual basis, but it kinda
Hmm.
gives you an overview of, like, the energy of what's happening in the practice and what's going on throughout the day, and it's, to your point, it's those conversations, whether they're happening one-on-one or on a team setting, are inexpensive, and they're highly effective.
Yeah,
Um, and you'll see the benefits, pretty much right away.
yeah, absolutely. I agree. Um, we're kind of moving into the question and answer time of our
Yeah.
office hours today. Looks like we have a comment. Um, From Danita, we have a team chat to update our team of 17 admin and counselors. Happy birthdays, prayer requests, office awareness. Absolutely. I think team chats are just vitally important, especially you have a team of 17 people. If you're not all there at the same time, which I'm guessing you're not, um, keeping that communication flowing in some sort of way. Satori says, I've been using Jane, I think, since 2014. There's been a lot of changes. I've been slowly adding the different tools to my tool belt. I've notified my employees. Oh, I've noticed my employees struggle a little bit to keep up with the changes as we add them. That's a great point. I think even as owners, it can be hard to keep up with additions and new features to Jane or other softwares that we're using. Jen, have you found kind of what would your approach be if you're coaching someone on how to keep up with those changes and implement them? Because my guess is Satori wants to fully utilize all these awesome features.
Yeah. I think if you are considering adding features to your practice and you want to be able to train those team members on whatever the feature is, or perhaps a more efficient workflow, Jane has such wonderful resources and tutorials that you can kind of set up a training schedule for your team, as well as meetings to discuss the implementation of new features and what your projected outcomes would be from those features. One, so everybody can be involved, but so that they also get kind of hands-on training before that feature is even implemented. And so if they have questions about it, or they may notice perhaps a pain point that may exist for them, you can bring that up, or they can bring that up either before it's implemented or throughout that implementation process. So really leaning on Jane's tutorials, I think, is a great first recommendation.
I agree. I would typically just link that tutorial for the person. And often I will wait until I fully understand the feature or I've had our admins start implementing it in beta testing or something. Or if it's specific to a certain modality on the team. So let's say like the new supervision feature came out
Mhm.
and it's really helpful for mental health counselors, but the rest of the team doesn't need to worry about how to use the supervision feature because they're not going to use it. And so we let them know, hey, this is here, but it's more instruction for the mental health team. Here's how it works. Please give me feedback. Let's create a timeline on, how we are working with it and all of those sorts of things. Um, Amar, I would appreciate any tips for keeping documentation as efficient as possible. This is a really, really important question, and it could be its own office hour. Amar, I'm curious if you can write in what type of provider you are, or if you're asking more about administrative documentation. I think clinical documentation, there are general practices that are helpful, and then there are, clinical, and then it does vary by your modality. There are nuances in that way. I think in general, and if we think about using Jane, there are shortcuts in Jane that you can create, phrases that you use often.
Yeah.
So looking at the Jane tutorials on how to create those phrases and shortcuts is really helpful. And then in your templates too, in Jane, your chart templates, you can create exactly what you need. Is it a whole host of check boxes that you just kind of go through each time? Is
Mhm.
it a more open format and it's that you need just to practice on your efficiency of your soap note? Um, and yeah, there's so much there. We could do a whole hour on, clinical writing. What do you think, Jen?
Yeah, I think you've covered it. I tend to work with practices that are going from paper charting to Jane.
Yeah.
And so what I notice a lot are maybe documentation tasks that can be appropriate for the clinician or for their support team. So their chiropractic assistant may be able to chart certain things during an initial exam, or report of findings, depending on kind of what that workflow looks like. But again, to your point, Jane has such robust content in the template library, and it really does allow you to create a documentation process that's individual to what you
Yeah.
need, and working through how you can be more efficient in that process.
Yeah, absolutely. And it looks like the Jane team posted the shortcut phrases guide into the chat if anyone is looking for that. And we can take a couple more questions. We have a few more minutes if anyone wants to write in. And we'll just take a minute. Jen, is there anything else that you feel like we missed today or you wanted to share with the community?
I don't know. I think we covered a lot of it. Just trying to think. Yeah, I think when it comes down to it, as you're, looking to reduce burnout, and just improve the day-to-day, communication is definitely at the forefront of that. And I think we've talked about all the different tools and systems that you can implement to improve team communication. And then also communication between the provider and the patient.
Mhm.
So Jane does have really great features to make sure that you're just staying on top of the day to day and it's not adding up. And you're not feeling that overwhelm at 5 o'clock thinking, I got 2 to 3 hours of charting or answering emails or whatever it may be. So I think, the biggest takeaway here is just improving communication and implementing policies and procedures where it makes sense within your practice.
Yeah. And I think just coming back to it starts with you as a leader, and modeling for your team. If you don't want your team members to be overworked, then you have to model what that looks like to not overwork yourself and not do respond to texts or emails at 10 p.m. or if that's your shift and your work time, okay, but outside of your work time, right? Um, and set boundaries and take care of yourself. And one of the coolest things about the field that we're all in is a lot of us have wellness centers or we have clinics or practices where we can literally go across the hall and get a massage once a week